see a life together, standing by you, and I think I want to forever. And after all has come and gone through all the years, I can't believe the moment's finally here. And you never looked so beautiful. You're everything I've waited for, so much more, standing right in front of me. And we go weather every high and low. If love is going where we go to have it hope forever, let's start our life together. Let's start our life together. Let's start our life together.
Welcome, everybody, to the first child webinar for 2022. I hope you've all had a terrific start to the year, and particularly those of you in Singapore, you're staying reasonably well at the moment. So, as you know, CHILD is one of the new centres based at the National University of Singapore. We are the Centre for Holistic Initiatives for Learning and Development, and I still need to read that, even though that I'm heavily involved in the setup of the centre. And I want to acknowledge our partners in the centre, that is the Lean Foundation, the Centre for Evidence and Implementation, of which I'm the Executive Director of, and A-STAR. We have a terrific webinar for you today. I want to encourage everybody to post your questions in the Q&A as you go. We make this quite interactive. If any of you are new to the way we run these webinars, and as conversational as possible. And if you start posting your questions, I'll be able to moderate as we go. But what I would like to do right now is speak a little bit about an upcoming conference that CHILD is having, and then introduce our speakers. So for the first time ever, CHILD is hosting a conference in Singapore and online. So it will be a hybrid conference later this year on the 26th, 27th, and 28th of October. Please save the date. You'll see a call for abstracts. We have fabulous invited speakers we're collecting, and the focus will really be on emerging issues and advancing early childhood through all sorts of innovations on program design, use of better research, implementing more effectively, and so on. So please watch this space. You'll hear more about that as the year goes on. And save it in your diary. Can I please introduce our fabulous speakers? And I'm going to start with Dr. Shang-Chi Chong. There she is. I am not going to read everybody's bio outright, but I want to just tell you a little bit about Shang-Chi, although if you're in Singapore, you should be very familiar with her already. Shang-Chi heads the Child Development Unit and works with the Ministry of Health on meeting the national objectives and ministry directives on the National Child Development Program. Shang-Chi, when you speak, maybe you can say a little bit more about yourself, because if I kept reading, we'd be going for quite a while. A very impressive CV. Next up, I'd like to introduce Dr. Tim Moore. Tim has known me since literally I was 5 years old. Don't let that judge. Don't assume anything about his age with me saying that, but assume that I am still very young. Tim is a senior research fellow at the Centre for Community Child Health at the Murdoch Children's Research Institute with the Royal Children's Hospital here in Melbourne. He's a child psychologist by training and heads a team responsible for monitoring, reviewing, and synthesizing research literature on a wide range of topics, which includes early childhood development. Tim is known to Singapore, has done a number of, quite a bit of work with groups like KKH and various ministries, and we are very lucky to have him here talking about place-based initiatives. And last but certainly not least, our very good friend, Dr. Brian Baumbarger. Brian recently got a PhD which I'm looking forward to seeing what effect that's having on his presentation style. He works at the intersection of research, public policy. He's the founding partner and CEO of the Science, Systems and Communities Consulting. He is based up in the US and also has an adjunct position with Griffith University in Australia. I've known Brian for a very long time. He is absolutely fabulous, and he also calls it like it is. So I'm very much looking forward to hearing, Brian, what you've got to say about place-based approaches. So as you would have seen from the information about the webinar, we are going to focus on place-based approaches in early childhood, or perhaps even outside of early childhood, given we're trying to learn more about them, what they are, how they can contribute to supporting families more effectively, maybe what the limitations are. So I'm going to start with you, Shangxi, and let you take the first question. In your experience, and all this question will go to all panelists, what has been the most effective application, if there has been one to date, maybe in Singapore? And can you describe that a little bit, or maybe define what you mean by place-based? Please go ahead.
Yeah, thank you, Robin. Welcome everybody to our webinar today. I'm very happy to be doing this with Tim and Brian. I'd just like to tell everybody, I've been a pediatrician for 20 years, and out of that 20 years, I've spent about 13 to 15 years just purely doing child development work. So what was opportunistic for me is when I became a developmental pediatrician, this was the time where Singapore at the National Child Development Program started to really build in its importance. And with that, the place-based approaches actually evolved. I think the two main aims of place-based approaches in Singapore were really like what a lot of countries are trying to do, which is really to talk about critical periods where we want to bring early intervention to children, as well as children with high health needs and development needs. And I have two R's to talk about why we do place-based approaches in Singapore. One is the right siting. So the first place-based approach, I think that was quite big in Singapore, was how we built in development supports for children in preschools. And it evolved because we were just creating an awareness for children with development issues. The hospitals could not carry so many children in our service delivery for children, and we should be carrying the kids with complex and high needs. Then where will the children with development needs be served well? And right siting told us that the preschools were probably the place. So the program started where we actually did the screening, as well as trained teachers and community partners to come together to provide that early intervention and development supports in the classrooms. And that was one place-based approach. If I read more about place-based approach now, Robin, I think that is also a little bit more of a place-focused approach, where actually there was a group of children we wanted to target, and we brought the services in. Like Tim would know, this would be more of like doing something for the children and with our partners. Now, the second place-based approach is the R of reach. This one to me is my passion, and this is the more complicated and complex way of doing it. But it really, really challenges to look at redesigning health systems for children. And this was for children who were from lower socioeconomic backgrounds. So for these groups of children, we know the complex intertwining of their problems cannot be solved by just one agency or ministry alone. And what I did in my passion project was I actually tried to go upstream, but redesign a health system and a development screening system with bringing interventions as well with our social care partners, as well as our education partners. So we really tried to co-design this together. In this, there was a lot of complex intertwining of challenges, but it really, really brought us to think about a national health screening program, which was not reaching these kids. I think as a pediatrician, this really, really upped a little bit of my comfort zone. I had to really step out and learn fast. And through this, I want to talk later about the partnerships as well, which was really, really important in making this kind of thing work. I would just like to add that in Singapore, I think we're well positioned to do place-based services. Singapore is very unique. The government structures are really strong. They're really supportive. We are very integrated in some manner, and I think very collaborative. People on conferences, and even Robin, you've told me yourself that you have not seen a country like that. I think we are small, but for example, the health systems are strong. We have 3 pillars of healthcare systems there, clusters. The early childhood side is really unified by the Ministry of ECDA. We have a very strong social and family ministry, and these ministries do come together to look at problems in Singapore. We are invited frequently to participate in that collaboration. And I think that really places us well in Singapore to do place-based approaches. I think going forward, I think really going forward, it would be to challenge ourselves how to do it better, how to bring the science in, how to bring a little bit more of what we ask as good questions, and to continue to partner in doing this very well for our country. Yeah,
that's a terrific way to set that up. Terrific. And just for those that aren't familiar with an acronym, ECDA, the Early Childhood Development Agency in Singapore, that is has remit for the early childhood area. Terrific. Thank you, Shang-Chi. Tim, can I hear a little bit from you and your experience and effective application of the approach? How do you define the approach? Please go ahead. But you're on mute. You think we'd all know better by now.
I'm unmuted. Thank you, Robin. Yes, our centre has in various ways had a long involvement with place-based approaches, and indeed across Australia there have been a number of attempts to do place-based work, as there have been in other places in the world. We call them place-based. In the US, of course, they might refer to them as collective impact initiatives, and or here we sometimes call them social impact initiatives. And they usually involve some kind of focus on a geographical area, being the place, and most often a economically disadvantaged area. So it's seen as a solution to areas that have got lots of problems, at least as seen by the service system. And as Shang-Chi mentioned, there is a distinction between place-focused and place-based. The place-focused, you can get a collection of services who come together and try to coordinate their services better, but don't really engage effectively with the community to understand their lived experience or the way that they would frame programs, and don't really share power. So that there is an interesting issue which we should explore there. My take on all of this is to, I'm a child psychologist, I always go back to basics. I want to go back and look at what do children need and what do families need. And in my most recent effort to do this, I've come up with a picture that tells us something about the rationale for place-based approaches and the way forward, and what it is that has been lacking in some of the attempts that have been made so far. And so the key things are this. First, that there is evidence that social determinants have a greater impact on child and family functioning than the services they receive. And that's a very salutary, and some of the social determinants are in the social and physical environments in which we live. Not all of them, but so therefore that's one reason why we should be thinking about the place. Secondly, when we look at the needs of children and the needs of family, what we realise is, we discover is the importance of social support. We are biologically hardwired to connect with one another. We're fundamentally social creatures, and hence the importance of having secure social networks and the corrosive effect of loneliness and the corrosive effect of not being well supported if you're a parent of a young child. And what has happened in our societies, at least to the Australian society and so on, is that there's been a change in the conditions under which families are raising young kids, which has partly taken the effect of an erosion of social support. If we have a look at the world in which young parents are raising young kids, and we look at the space, the time between birth when we know where they are, and school where we know where they are. They can be anywhere in between. There isn't a logical place, a natural place within the community where they can go to meet one another and build social networks on the one hand, and on the other hand, where they can access integrated services. So this suggests that we need to think about both the social side of things and the service side of things. And we need to think about them simultaneously. Going back to your question, Robin, is where has this been done well? And I've recently done an international survey of attempts to look at integrated child and family centres, for instance, to try and find where it's being done well. And I would have to say that there isn't anywhere that is doing it, doing all the elements that I think we could now identify as being important for a place-based integrated service support system that creates an environment that provides social support for families in positive ways and access to integrated services for other basic needs that they have. We've had some great examples in Australia. We particularly like the Tasmanian Child and Family Centres, where our centre was involved in the establishment of those, and that very much followed a co-design process, probably as good a co-design process as there has been anywhere. There are other excellent examples, such as the My Place program in Victoria, and we're doing work with some great initiatives in rural Victoria. So those programs are good examples, but none of them have yet reached the point where you would say they are meeting all the criteria. We're also doing some work within our centre, which is more, if you like, more conventional research stuff rather than working directly with place-based initiatives. We have our Kids in Communities program, which has looked at social determinants. We have our Restacking the Odds program, which is now on to looking at indicators as a way of moving things forward. And we have a CRE on child adversity, which is looking at child and family hubs and looking at how to establish those. So all of those are models we can learn from, but none, as I said, have yet reached the point where I'd say, yep, there's the example that we should be emulating.
I really want to ask you why, but I'm going to, in a follow-up question, and go to Brian next, because that's an interesting observation, Tim. So Brian, in your experience, which I know is different to Tim's and Shang-Chi's, let's hear a little bit about where, your ideas around place-based, where you've seen it be effective or not, or.
Right. Thanks, Robin. I kind of came to place-based through a different pathway. My work for a lot of my career has really been focused on the challenge of scaling evidence-based practices. So the idea that certain interventions, prevention interventions, treatment interventions, demonstrate some level of effectiveness in rigorous experimental trials, and then the challenge we think of those evidence-based practices as being, what works, what's effective, and so the challenge is then, okay, how do we get the things that we think work the best or that we can have the most confidence in? How do we get them? How do we promote uptake of those evidence-based strategies? And so within that challenge, along that journey of trying to understand and promote the scaling of evidence-based strategies, the idea of place-based and the question of place in all of that became increasingly important. So obviously, evidence-based practices need to be well matched to specific needs, right? So if you think of a pharmacy, you go into a pharmacy, you see the shelves lined with things that have been tested in rigorous trials to make sure that they're safe and effective. Well, everything in the pharmacy is effective. It's evidence-based, but that doesn't mean that you can just grab anything and take it as a medicine, as a treatment, and that it'll solve your problem. That medicine needs to be matched to a need. And so, we typically do that at the individual level, whether you're thinking about a medical need or a social behavioral need. So we typically think about matching problems to treatments at an individual level. The same ideas obviously can be applied to populations, but considerations of place are very important in that matching. And when I say place, in this case, I'm talking about a geographic space, a community. So if you think about Bronfenbrenner's ecological model, children are embedded within families. Those families are embedded within communities, right? So the community as a place has a lot of bearing on matching needs to services, especially if the outcomes that we're trying to move the needle on are at the population level. We can make individuals better. We can reduce the likelihood of poor outcomes for individuals, but eventually we need to do that with whole populations. We need to, that's the sort of the brass ring that we're chasing, is to achieve population level public health impact. And so every community is concerned about the same poor outcomes for children and families, but the constellation of risk and protective factors that set children on a positive or a negative developmental pathway might be very different from one community, aka place, to the next. I'm a criminologist by training, so I think about teens, I think about adolescents involved in youth crime. So I think about that as a specific outcome and a system, that the youth justice system that I work with frequently. Typically, what brought an adolescent to the attention of the youth justice system, typically that outcome started many years before, in early childhood or even prenatally. So I think in terms of developmental trajectories toward or away from desirable child development outcomes. And thinking of these developmental trajectories, we can identify common or predictable milestones or events that might take a child off a positive developmental trajectory and onto a pathway towards one or more negative outcomes. So you can take that idea of thinking about the developmental trajectory or a pathway towards or away from positive or negative outcomes. Think about that not at the individual child level, but at whole cohorts. So think about every child that is born in a given community in a certain year, and think about tracing their developmental trajectory from birth to adolescence, for example. And we can predict common events or environments where many children are likely to change pathways. And so those present us with opportunities and targets for intervention. And so when we go back to this idea of trying to scale evidence-based models, evidence-based strategies, those present particular places where we are most likely to effectively intervene. And again, if we think about place, if we think about community, then we can identify where those most likely points of intervention are in the context of a given community. So again, the constellation of risk factors in one community can be very different than the constellation of risk factors in another community, even if all communities are concerned with a common outcome like delinquency or youth violence or youth drug use. We need to think about what are the constellation of risk and protective factors in this particular community that present us with opportunities to intervene. And so that's the way I think about place-based approaches.
Have you, all right, well, let's go, because there's some common themes there, and both you and Tim have talked what I would say, almost describing these, use core components or elements. Tim, you talked about, the basis or the things that need to be made up in a place-based approach. So let's just sort of think about that, and then maybe, because it's quite complicated, think about some of the limitations that you've been aware of. And Tim, I'm going to go to you first, and then Brian, then Shang-Chi, I'm going to come around to you. And please post your Q&As. I've got a couple that I'm going to in there now that I'm saving. But I really do want to hear a little bit about, again, Tim, you mentioned the examples you gave haven't, fully developed, or I can't remember the term you use, or they haven't sort of put all the bits and widgets in place. And can you talk a little bit why, and maybe some of the limitations you've seen, and if you have some ideas on overcoming them? And then I'll go to you, Brian, with the same question, and then you.
Okay. So the reason we know that the programs have not yet reached being fully successful is we haven't yet made a difference to the problems we're trying to tackle. We've got these major complex issues in which are puzzling in the light of the fact that we live in well-off societies. Why have we got these intransigent problems that have to do with intergenerational poverty or child abuse or family violence or all of these kinds of issues? We haven't succeeded in shifting those at this point. So there's something about the way that we're going about it that isn't working. And part of it, I'd like to sort of push back on Brian's approach to identifying the risk factors. I think it's perfectly valid, but I don't think it's sufficient. Because the issue is those are the risk factors that we see, the system, the professionals. That's how we frame the problems. And the services that we design are also how we think the answers are. And we use these elaborate ways of demonstrating that they are effective. But we are engaging, when we come to roll them out in the real world, we are engaging with communities who have their own dynamics and their own perspectives and their own solutions. So if we don't take those on board and engage with them, then we reduce the chances that the solutions we come up with and the ways that we frame the problems are actually going to seem important to them. So there's the challenge. In some of the work my colleague Beck Fry and I have been doing with one of the rural social impact initiatives, Hands Up Mallee in Victoria, we've been using the frame of a three-legged stool. So we're saying what we need is research evidence as one leg of the stool. So there's Brian's initial starting point. How do we scale up the effective programs? The second leg of the stool is data. It's the evidence that we get from how many kids are immunised and how ready they are for school and all these kinds of important things. And then the third thing is the lived experience of the community. What's it like being in that community, and what do they see as the things that need to be fixed that would make their lives better? They don't necessarily frame them in the same way that we do. And the solutions they come up with aren't necessarily the same either. So we need a way in which we can integrate those three sources of information. We need a decision-making framework that integrates them, that gathers the information. So people like me and like Brian, who might be able to synthesize the knowledge and say, this is what we know works. Then there are the local local council or whoever who gathers the information about that indicates how well this community is travelling in terms of the indicators that we've got. Then there's a community. How do you engage with them? And the Hands Up Mallee group that we're working with are into that. They're into the listening bit. How do you listen? How do you hear the message? How do you then empower those people to be part of the solution? That's the challenge. And that's why I say that I don't know that any model has completely cracked that. There are other aspects that aren't being fully addressed, like the social determinant side of things. I think we're generally strong on services and weak on the addressing the conditions. If you don't address the conditions, then all the services in the world are going to struggle to compensate for conditions which compromise parental capacity to be able to raise their kids as they and we might wish.
All right. Well, Brian, I think you definitely need to go next, given that Tim's putting a challenge down, which I like very much. And I note you want to talk a little bit more about what's effective to sort of walk yourself to limitations. So please go ahead.
Thanks, Rowan. Yeah, I mean, I think a lot of what Tim is bringing up is that, that all our highfalutin science and research needs to be checked and grounded against the realities of people's lives and what lived experience is. And and obviously it has to be that science, that knowledge base has to be co-created with the people whose lived experiences we're ultimately talking about. I want to talk just a little bit about one of the most effective place-based strategies, and in fact, a model that introduced me to the idea and the application of place-based strategies. And interestingly, going back to Tim's earlier comment, it also introduced me to the idea of collective impact before it had that name. I was involved for well over a decade with the implementation at scale of a model called Communities That Care. It's a community level decision support system, essentially, decision support system for communities themselves. So we to ground the science in the reality of families and communities' real experiences, we need to think about what's already going on, what is already happening in communities to try to promote better outcomes for children or prevent poor outcomes for children. And what is already going on, a couple of things. One is that in every community, in every country, there are a variety of disconnected people who are working in that space, who care deeply and are doing various things in the name of promoting better outcomes for children and families. That's everybody. That's the parents themselves. That's NGOs. That's community-based service providers. That is teachers in a classroom. So there are many, many people who in various ways are working towards the promotion of better outcomes for children. But they're disconnected and they're all working with a different mindset about what causes those problems and what might work to prevent those problems or promote better outcomes. So there's all of these caring people doing things. And the other reality that's constantly happening is all of those people are making choices. They're making choices about what programs or services or strategies will be effective in that regard, toward that end of promoting better outcomes for children and families. So this idea of Communities That Care as a community level decision support system, it really seeks two goals. How do we organize into a collective impact coalition? How do we bring all those people together to have them work collectively towards some jointly identified priorities? And then how do we help them make better decisions about how do we help them make data-informed decisions about what would be the most effective, what would most likely be the most effective strategies. So this idea of communities that care, it's really kind of a six component process. It's a 6-step process. First, like I said, we organize diverse groups of stakeholders in this collective impact community-based prevention coalition. The second is that we educate them about what research says are the known risk and protective factors that have been statistically associated with better or poorer outcomes. Then they set about, this community collective impact coalition sets about gathering data on this known set of risk and protective factors. And then it uses that data to create a diagnostic risk profile for that specific community or geographic catchment area. It might be a school district or a neighborhood. Then after they've created that diagnostic profile, along with an assessment of their current programs and services, they identify gaps. Are there high priority risks in this community that for which we don't seem to have adequate programs or services, or for which the current programs or services don't seem to be making a difference in that particular risk factor or protective factor? And then so that leads them to have chosen some specific narrowly defined priorities that they want to pursue. And then we help them we work with that community to compare their identified needs against the current evidence base of programs and services and try to do good matching. Okay. And then, of course, guided by current implementation science, they carefully deliver and hopefully sustain those programs and strategies in a way that's informed, like I said, by implementation science, setting and monitoring process and outcome measures, and engaging in continuous cycles of quality improvement. So that particular model, communities of care, it's actually been replicated in lots of states and many countries, in fact, and it's been tested in randomized controlled trials at community level, randomized controlled trials, and it's demonstrated evidence of effectiveness at moving the needle on outcomes of children measured at the population level, measured at entire age grade cohorts, for example. Now, that so I think there is evidence that this idea of place-based strategies using a collective impact framework can be effective, but there are limitations. Obviously, first of all, one of the and I'll be real here. One of the biggest limitations of place-based strategies is that idea becomes so attractive that people start adopting the language of place-based without considering what it actually means or why it matters. So not having like a clear logic model for what does place have to do with any of this. A second limitation. Can I continue to go into limitations a little bit, Robin?
Yeah, you get in there. And Shang-Chi, I'm coming to you because this is very relevant for the context you're in, but keep going, Brian.
Okay, so just two more limitations, I think. So the second limitation, even in the face of my optimism that place-based combined with community collective impact can be effective, the challenge is that this whole place-based collective impact strategy relies on this matching of identified needs with effective services. So it relies on the evidence base. And the reality is that research and evidence is a moving target. It's constantly evolving. So think about the rapid evolution of our knowledge and understanding of COVID, for example, right? And how our strategies for prevention and mitigation have to be constantly adjusted to where we think they represent the current knowledge base. So, the same is true with all of the things that we're trying to consider. So we're constantly having to go back and say, well, is the knowledge base any different now? Are the risk and protective factors any different now? Are the evidence-based interventions any different now? So that's obviously a challenge. And then, going back and aligning with what a lot of Tim described, what this communities that care model that I described, it's a multi-step, multi-component strategy. And so each component and step presents challenges and opportunities to get it wrong or at least not quite right. And so, for example, the CTC, the communities that care model that I just described, it relies on adolescent self-report data on those known risk and protective factors to generate that community risk profile. Well, if you're trying to work with younger children, you can't ask them to complete a self-report survey to give you data on the known risk and protective the prevalence of known risk and protective factors in that particular community. So gathering the good data that's necessary to create that community risk profile that connects the knowledge base to the place is, that's fundamental to the whole process, and that can be challenging.
Okay, before you go there, before Tim, because I can see Tim has his microphone off, Shang-Chi, just reflect a little bit on what you're hearing from both Tim and Brian and your perspective on the reality of that for Singapore. And I dropped out a little bit there, so I might have missed some absolute pearl of wisdom from Brian, which I'm sure I did, but you get in there.
Yes, Robin, I think what Tim and Brian have said are really true, because place-based approach must be clearly defined by the service providers in Singapore in the first place. And I think because we are so new to doing this, even what it means, how we do it, and the methodologies that we can adopt to look at this properly is still very new. So I would think that, like Tim said, right, the systems thinking process needs to be in place first. How do we as a country think about this whole system integrated together? It's not just integrating services, but what we design must really try to shake up a little bit of what we are practicing routinely day in, day out, perhaps, right? The second thing is how we mend and blend specific areas of research. Like somebody asked in the chat group, it's a very good question. We are very good at measuring child outcomes, family outcomes. I know that there are social outcomes as well. And I think how do we integrate such outcomes together in the whole process of doing this? I think Singapore does not. We are very new to this, and I think we would challenge ourselves to step up and maybe learn fast. The other thing is this fortress mentality. Sometimes we call it. No one organization should have adoption or a scaling hierarchy that says this is the program that I think is the program that we want, but how do we humbly say that I don't know enough about some of these parts here, and we learn and share together, put the data and what we know together and creatively come up with solutions. I perfectly understand what Tim is saying, that systems design could be there. The community participation research is also not blended well. And I think just by doing the pilot study I had, just looking at health of children, we realized that the barriers in health systems, which could maybe be easily tweaked, should be floated up for something to be thought about. And they're really being looked at now, I'm very happy to say, because of that very strong participatory government that listens to the ground. And how do we engage families? I feel that we are really doing things for them. How do we do it with and through them? Like Tim says, it takes a lot. These people are really passionate. They're really people who really care about these families. It's now how do we do this with and through the families? What do families struggle with day in, day out, that we do not give them the efficacy or the ability to participate in such place-based services with us? These things need to be primarily looked at first before we start pushing in beautiful design programs and things like that. My little take on it. Yeah.
I've never seen a program that's beautifully designed yet, Chongqi. So if you know of some, you should point me towards this.
Like Tim says, perhaps it's very hard. We have to be realistic to balance a few factors and what's acceptable and what's good enough also. And I just think, Robin, whatever it is we do, we are better 10 years now than we were 10 years ago. We will be better in 10 years' time as well. Yeah.
Yeah, you're a very, very optimistic person, Shang-Chi. It's very good for the soul. I want to pose a question. We're getting some nice Q&A up there, and I can see some familiar names. So hi to you all. There's a question, I think all three of you have sort of touched on this, and in my experience can be one of the toughest things around place-based approaches, and that's around governance. And Tim, there's a question there sort of, I think, was a bit inspired by your three-legged stool. Can the panel speak to governance challenges around implementing initiatives in their experience? Is there a fourth leg around government, and can others respond on how to effectively do that? And I think the same person added better governance in place, urban planning. And I've seen a lot of place approaches, particularly in Australia and the UK, sort of fall apart due to some governance issues, which you think would be the easy part. So let me start with you, Shang-Chi. Do you have sort of examples around governance of a place-based? And I'll go Tim and I'll go Brian.
Actually, Robin, I actually, when I was thinking about this topic, I had 3 S's, which I thought were the challenges. It's not really only relating to governance, just by looking at how we are trying to help families in the communities. One, it's all about the balance in these 3 S's. The first S is the service versus the research or the implementation science that comes together with it. How do we balance? Because the service leaders are actually the implementation leaders. And these are the people who really, really have the experience on the ground, but are trying to lead the service teams, like Brian said, deliver the service, plus at the same time, put in all these implementation science elements that gets us the data that we want. It's like the car is moving and you're trying to change the wheels. And with that, we will have the 2 S's of the speed and scale, you see. So we want good quality things to scale. Good quality things do need time to build, and the speed that we do it must be comfortable for the ground and also must be comfortable for the families. The second is really also that, we actually have that when we're trying to scale, sometimes we are in that difficulties because I think we really want to quickly provide services for families. Do we scale our services and then build in elements of good quality research in? Or we pilot very good quality trials and then we scale. And sometimes even I myself ask, which one should we do first? How do we do both? Like this, I don't think there's a perfect answer. I think when we are coming together to think of these solutions, these are the things that perhaps challenge what we need to deal with on the ground as well, Robin. Yeah.
Yep. Yeah. So Tim, what's your thoughts on governance and the challenges, or how it helps? And can I just compliment you, Shang-Chi? We've had 2 R's and 3 S's from you. Who knew you were so good at summarizing via? So we're going to put you to work on Child with all our acronyms. We're coming for you. Please go ahead, Tim.
Okay. Obviously, within the collective impact field, one of the core elements that they identify is the notion of a backbone organisation. And that's been taken up in many of the initiatives, place-based initiatives in Australia. There will be a backbone organisation, a group that has funding to support the collaboration and to make the linkages and so on. Now, does that constitute an adequate governance arrangement? Obviously, governance really involves the question of how decisions are made and how power is shared. And I don't know that we've got models that do that. Because if we want to think about all the things that we want to take into account, all the conditions that families are living under, and how we engage them and how we engage the research and how we engage the where is the structure for that? What we don't do and what governments have struggled with for ages, despite the rhetoric of adopting co-design, co-production kind of language, they don't really know how to do it. Because what it means is that you have to give up some degree of control in order to gain a synergistic level of power, as it were, that the sum, by apparently giving up some power and sharing decision making, and allowing a community to share in decisions about how money is spent and what are the priorities and so on, that is dead scary for governments and for government departments. And that's where the learning has to occur. We don't really, at this stage, know how to do that.
What a revolution that would be, huh? Shang-Chi, I can see her vigorously nodding her head in terms of the way that all the various government committees that you're on, etc. Brian, what's your thoughts on this?
Yeah, so I mean, I don't know how well this translates or doesn't to Singapore, but in the U.S., we've created and siloed our public systems around narrowly defined problems. And fortunately, I guess, because I've worked so much in the area of primary prevention, if you're looking at primary prevention and you're going upstream to, as far as you can, like I said, I'm concerned about youth crime and the youth justice system in adolescence. But to trace that problem to its roots, I have to, go to early childhood and even prenatally. So that's led me to work more and more in primary prevention, starting as early as possible. Well, if you go far enough upstream before the problems have occurred, this is both a good thing and a bad thing. No system yet owns those problems because they haven't occurred yet. So, but who does? So the system, the youth justice system, education, if you're talking about kids before they're even in school yet, if the mental health or behavioral health system that responds to problems after they occur, nobody owns those problems before they occur. No public system does, but who does? The families and the communities. So that's where the energy is. That's where the motivation is. And so, for example, in this communities that care model that I described, we're pulling together lots of people to think about how to solve problems before they've occurred. And that whole model really, it involves local governance. We provide an infrastructure. We provide the model, this decision support system provides an infrastructure or a framework around which they can gather and work together. They make the decisions. They decide on what the community's priorities are. Now, we want that to be guided by data, obviously. And we want we would encourage the communities to seek or at least be aware of which strategies have evidence of effectiveness, because the reality is there's lots of programs and services out there that not only don't work, they cause harm, right? So we need to set some guide rails about what choices we want communities to make, what decisions occur out of these decision support systems. So I think community-based governance, true, authentic, community-centered governance is absolutely possible. We've seen it happen, but like all of these other components, there's a science to the way you do that. I mean, just saying the term collective impact, there is a science, there is a research base about how to do community collective impact effectively. And so we need to marry that science with practice in communities and think about what infrastructure is necessary. We get so wrapped up in the what, we don't think about the how. And part of the how is the infrastructure that needs to be in place to facilitate this kind of community collective impact and local governance.
Well, that is a very nice segue to my final question in the final few minutes that we have, which is, as Singapore goes forward, as we think about how place-based approaches can really support, and Shang-Chi, I'll come to you last, so you get the final reply as the person's closest to the system. But what to look out for? What to look out for? A couple of things that we could, that are must-dos with place-based, or do we need to wrap around better evaluations? There's been quite a few criticisms of the low quality evaluations around place-based. So I'll go to you, Tim, first, then you, Brian, then last, Shang-Chi. A couple of sort of, what can we share with the participants here today that will really go, if you remembered this or you did this, would really be contributing to improving and helping place-based approaches live up to their potential?
Yep. Okay. True co-design, co-production with communities is the first starting point. That's the bit we have most trouble with. And that changes everything. That leads to, if we do that properly, then that can potentially change the issues of how you evaluate, what strategies you use, what evidence works, and so on, and what data you need. And we don't really know how to do that. So sharing of genuine power with communities is important. The three-legged stool notion of having a practice framework for how you integrate those three sources of information and how you come up with decisions is important. I think we need to focus much more on the conditions under which families are raising their kids. We understand what those conditions are, and we typically don't focus on those. We have a default service-oriented approach, and that involves choosing the most effective programs and thinking about how to integrate services and expanding the range of services that are offered and so on. Maybe that is only part of the solution. We need to understand the conditions and know how to address them. And we also need to know how to integrate services in a way that make it easy for families to access. And I think we've got some ideas about how to do that. And we need to use a tiered approach to addressing the additional needs that any families have. We don't really have a very effective way of doing that at this stage.
I see anybody integrate services well, I will also be shocked, and I will go, that will be the end of my career. I'll be like, you did it. All right, we're done. Fine. Good. Brian, please go ahead. A couple of final words about where to go.
You're such a pessimist.
I know, right?
In a critic way.
I know.
Well,
exactly
so,
it.
if I had, there's a lot, obviously, we need to think about, but I can't help but go back to data. And we complain so much about, we want people to make data-informed decisions, and we don't do well enough with that. But we need to get to innovative solutions, right? We need to think again. We need a good, strong logic model that says, what is the role of place in what we're trying to do? Why does it matter? And then, based on that strong logic model that recognizes the importance and the value of place in our equation of getting better outcomes, we need to think about, in a given context, what is the data challenge? Why isn't data being used more and better, and in better ways, more effectively? And we need innovative ways to really address that data challenge.
Excellent. Shang-Chi, you take us home. You can also just totally disagree with the two of them. That's the fun thing about going last. Please go ahead.
Robin, I do not want to say I'm any expert in this field either. I think that we are already having very high quality healthcare services, social supports for families. I feel that what I don't know about is checking my own blind spots and checking our blind spots, and really, really asking ourselves, what is not just the outcome, but what is the real question with how we are doing this that needs to change? Now, there's one thing that I like, which is a tiered approach. Even at child, we are talking about even screening better risk assessment for families. And perhaps I think for a specific group of them who have very, very high risks, we take more time to design something better. And at the same time, a preventive population approach will move. And we try to see how we can do better. And the second thing is this participation of families in that decision-making process, to me, is still something that I want to learn more about doing. Like Tim says, is absolutely important, because out of the 3 stools and the legs of the stools, at the end of it, we are really, really wanting to see what is the lived experience of that. Yes. And this is a very interesting article where we talk about the science, the genetic code. And then it says genetic code versus postal code. And, the blend of all the different types of codes. And what to me is Singapore has a very high standard of living, and we don't have vast poverty areas, but I think we have communities of people who probably need to have perhaps a bit of a bigger participation in their own design of what they feel may help them. It's a bit like disability research. We also involve people with disability in participating in making decisions for them. I think for this group of people, we like people who are living in poverty. This could also be one of the ways that we do more of with them and through them, and not just for them. Yeah.
Well, that is a very inspirational way to go out, which is why you're perfect to go last. So thank you to the 3 of you very much for agreeing to do this and getting very little prep from me. I like to just keep it a bit edgy for people. Thank you to all the participants and the questions. I'm sorry we couldn't get to all of them, but the team has taken a copy and we'll send them to the speakers. See you at our next webinar. Don't forget about our conference, and have a good rest of your day.
Look in your eyes and I can see a life together. Standing by you, and I think I want to forever. And after all is come and gone,